Hello, my name is Christella Dostumuchiza, and I'm working as an assistant human resource in Strong Memorial Hospital. And in the past few years, we have been facing a problem of few employees, and so we decided to make a job fair with employees who have required skills and professionals related to healthcare careers. So in this presentation, I will take you through some of the healthcare careers that a person can take. And some I will start with non-clinical healthcare jobs, where I will start with medical assistants. These are people that you usually meet when you enter a doctor's office. Their duties is to check on the process of records, keep appointments, and track prescriptions of patients. They can also do small tests, for instance, blood pressure and some lab tests, which are simple. And the education or the skills required for this person or medical assistant is they should be having an associate's degree, which is earned in 2 years at the community college. And I will take you through the another career, which is health information or managers or technicians. They manage the flow of medication and also track the information of patients. The education required here mostly is a bachelor's degree, but when you're a junior health information manager, an associate degree is required. The skills of this person should know about medical terminologies, medical law, and medical coding systems as well, because he will be dealing with information. And lastly, the position of non-clinical, which is non-clinical job, is healthcare administrators. This is the title that involves a range of tasks, because this person leads the entire organization, a health organization. This person should be having skills in finance management, because the roles are finance management, staff management, and project planning. He also involves in policy and procedure implementation. So the education and skills required for this person, it is better to have a master's degree in health administration, or sometimes people choose to do an MBA in concentration in healthcare. And so it means that the person should have finance, business, organizations, and law and ethics, but related to healthcare settings. And another part that I want to talk is allied health professionals. I will be giving some examples related to allied health professionals. This is commonly in the US, as you know, but it has broadened to other countries. This term is described as a variety of healthcare providers who are not doctors, nurses, or dentists. Their objectives are to prevent, diagnose, and treat conditions and illness. It goes with patients, and they often work in multidisciplinary team to provide the best for the patients. um, Taking you to some of the examples, we can talk about the dental hygiene. They are responsible for preventing oral treatment, preventing and treating oral diseases. And taking you to the dietetics, these advises patients on how they can take their nutrition for health, weight management, or for specific medical conditions. I will give an example of exercise. Physiologist. This focuses on therapy and rehabilitation of injury or chronic diseases and disability through exercises. Um, Talking about audiologists, these people make assessments and also treatment and prevention of hearing or balance disorders. This is related to hearing mostly. And Talking about social workers, these people help or deal with personal and social issues through counseling, community engagement, and advocacy, and also during launching some various programs related to health. Lastly, occupational therapy assists people with illness or disability to develop or maintain the living and work skills. The last part that I want us to discuss is about uh, the difference between LPN or licensed practical nurses and registered nurses. Some people seem that they sense them to be similar, but they have differences related to jobs, their duties, and their education. We start talking about the licensed practical nurses. Their level of education, they need to be have completed a state approved education program which typically takes 1 year, whereas registered nurses, they need to have they have three educational options. They take bachelor's of science in nursing, or they would choose an associate degrees in nursing, and lastly, or a diploma from an approved nursing program. And we're not going also to leave about nurse practitioners. The entry level preparation for nurse practitioners is the master's or postmasters or doctorate level. And talking about their typical job responsibilities, licensed practical nurses, they work under the direction of registered nurses and doctors. So they mostly have do basic nursing care, and registered nurses do primary administrator medication treatments and offer education activities to advice to patients and the public. Whereas nurse practitioners, they are higher than all the two categories that I was talking about, because their role continues changing to the societal and healthcare needs. They sometimes go involved in professional organization and participation in health policies activities at the local and state or international levels. They also combine the roles of provider, mentor, educator, and researcher and administrator. Uh, all these forms of nurses that I've been talking about, they need to be licensed or have required certificates. They both have to get registered in order to perform their duties, where RN or LPN or nurse practitioners must do a national council licensure exam in order to obtain a license and be able to work as according to their education or their orientation field. Thank you so much for your kind attention.